Well, with the weather heating up, many of you are taking your plants outside.
Yeah, we all love a little sun, but not protecting your skin could be risky business. CBS North Carolina weekday morning anchor Stephen Chase talks with our medical expert about preventing skin cancer.
If you're enjoying the outdoors this weekend, use caution. Doctors want you to know skin cancer is the most common form of cancer in the U.S. today. You probably already know that exposure to ultraviolet light from the sun, even tanning beds, is a major risk factor for melanoma, which is the deadliest form of skin cancer. But is slathering on the sunscreen enough? Well, we brought in Dr. Kevin Campbell, our medical expert, to tell us more. Great to see you, Doc.
Good to see you.
Okay, so before you answer that question for us, tell us about some of the common types of skin cancer.
So there's really two major, very common types. It's called squamous cell and basal cell. These are skin cancers when you see your dermatologist. If we catch them early, very, very treatable and curable.
Okay.
Melanoma is very rare, but it accounts for 75% of all the skin cancer-related deaths, which is not an insignificant number.
All right, so let's talk about sunscreen, because we know this is one of the best aids when it comes to protecting ourselves, our bodies, our skin. What do we need to look for when it comes to the labels?
Just like when we're buying food, you've got to look at the labels. You want to make sure it's broad spectrum, which means it covers both UVA and UVB rays, which are two types of ultraviolet light. You want to make sure that it has SPF 30 or more, which is the amount of protection that it has in there. And if you're a sportsman or a sportswoman, you want to make sure it is waterproof so that you go and reapply once you get it out of the water.
All right, that is so important, especially for all of you golfers out there.
Absolutely. Wear a big brimmed hat.
Oh, nice. Yeah, definitely like the hat suggestion. What else do we need to know when it comes to preventing skin cancer?
Partner with your doctor. It's so important to see a dermatologist once a year. Do a total body skin check, because they can find things that you may not notice that are precancerous. They get rid of them before they become cancer. Also, why, if you're fair skinned like I am, slather on the sunscreen, wear wide brimmed hats, and use common sense. If you're at the beach, avoid 10 a.m. to 2 p.m. Go out early in the morning, later in the afternoon. The rays aren't as intense.
So lighter skinned people are more vulnerable. Darker skinned people like myself, though, we still need to use our sunscreen.
Absolutely. Everybody's at risk. Fair-skinned people tend to have a higher risk for melanoma.
Interesting. Doctor, thanks so much.
Thank you.
Well, if